Hello everyone, now let us discuss about pelvic girdle and hip joint. So the pelvic girdle consists of two hip bones. Pelvic girdle consists of two hip bones called as coxal. Cox means hip. Coxal or pelvic bones or OS coxal. The hip bones unite anteriorly at a joint called as pubic symphysis. Hip bones unite anteriorly at a joint called as pubic symphysis. They unite posteriorly with the sacrum at the sacroiliac joint. They unite anteriorly at pubic symphysis and they unite posteriorly with sacrum at sacroiliac joint. The complete ring composed of hip bones, pubic symphysis, sacrum and cox form a deep basin-like structure called as the bony pelvis. The plural is pelvises. And functionally, the bony pelvis provides a strong and stable support for the vertebral column and pelvic and lower abdominal organs. Here you can see the bony pelvis. The blue color area, entire blue color area is the bony pelvis. The hip bones unite anteriorly at the pubic symphysis. This is the pubic symphysis. The hip bones unite anteriorly at the pubic symphysis and posteriorly with the sacrum at the sacroiliac joint. The pelvic girdle of the bony pelvis also connects the bones of the lower limbs to the axial skeleton. The pelvic girdle is the area where bones of the lower limb they get connected with the axial skeleton. Each of the two hip bones of a newborn, this is an important point, there are two hip bones in an adult. Each of the two hip bones of a newborn consists of three bones. Each hip bone is made up of three bones separated by cartilage. A superior ilium, an inferior and anterior pubis, and an inferior and posterior ischium. Ilium, pubis and ischium. These are the three bones which form one hip bone, and by the age of 23 the three separate bones fuse together. Although the hip bones function as a single bone, anatomists commonly discuss each hip bone as three separate bones. So here is a detailed lateral view of right hip bone. Ilium, ischium and pubis, all three bones together they form one hip bone. Ilium, ischium and pubis. One more important point here is the acetabulum. Acetabulum is the socket for the head of the femur. Acetabulum is the socket for the head of the femur where the three parts of the hip bone converge and ossify. The three parts of the hip bone converge and ossify at acetabulum. This is the acetabular notch and this is the acetabulum. This is a socket for the head of the femur. This is a detailed medial view. Anterior, posterior, and this is medial. This is pubis, ischium and ilium. This is iliac tuberosity. And this one is the body of the ischium. And this is the ischial tuberosity. This is the orbiturate foramen. And this is the body of the pubis, pubic crest, and inferior ramus of the pubis. Superior ramus and inferior ramus. We will discuss about each bone in particular, ilium, ischium and pubis. Coming to the ilium, ilium is the largest. Ilium is the largest of the three components of the hip bone and is composed of superior ala and the body. The body is one of the components of the acetabulum, the socket for the head of the femur. And one more important aspects of ilium are spines. The superior border of the ilium, the iliac crest, ends anteriorly in a blunt anterior superior iliac spine. And below this spine is the anterior inferior iliac spine, and posteriorly the iliac crest ends in a sharp posterior superior iliac spine. One more important point is the bruising of the anterior superior iliac spine and associated soft tissues which commonly occur in the body contact sports is called as hip pointer. And below this spine is the posterior inferior iliac spine. And these spines serve as point of attachment for tendon and muscles of trunk, hip and thighs. The spines, they serve as a point of attachment for the tendons of the muscles of the trunk, hip and thighs. Below the posterior inferior iliac spine is the greater sciatic notch. This is also important point. The spines are important. They serve as a point of attachment for tendons of muscles of trunk, hip and thigh. And below the posterior inferior iliac spine is the greater sciatic notch, through which the sciatic nerve passes along with other nerves and muscles. So sciatic nerve passes through ilium at sciatic notch, greater sciatic notch. And sciatic nerve is the longest nerve in the body. Sciatic nerve is the longest nerve in the body. Ilium is the largest component of the hip bone. Medial surface of the ilium contains iliac fossa, a concavity where the tendon of iliacus muscle attaches. And posterior to the fossa are the iliac tuberosity, a point of attachment for sacroiliac ligament, and the auricular surface which articulates with the sacrum to form sacroiliac joint. Projecting anteriorly and inferiorly from the auricular surface is a ridge called as arcuate line. Projecting anteriorly and inferiorly from the auricular surface is a ridge called as arcuate line. And the other conspicuous markings of ilium are three arched lines on its lateral surface. Three arched lines on its lateral surface called as posterior gluteal line, anterior gluteal line and inferior gluteal line. And the gluteal muscles, they attach to ilium between these lines. Coming to next bone, that is ischium. Ischium means hip. The inferior posterior portion of the hip bone comprises of superior body and an inferior ramus. Ischium contains of superior body and inferior ramus. The ramus is the portion of ischium that fuses with the pubis. Ramus is the portion of ischium that fuses with the pubis. Features of the ischium include prominent ischial spine, a lesser sciatic notch below the spine. Greater sciatic notch is on ilium, whereas lesser sciatic notch is on ischium, and a rough and thickened ischial tuberosity. Because this prominent tuberosity is just deep to the skin, it commonly begins hurting after a relatively short time when you sit on a hard surface. Together, the ramus and the pubis surround the orbitator foramen, the largest foramen in the skeleton. So, which is the largest foramen in the skeleton? Obturator foramen. Obturator foramen is the largest foramen in the skeleton. The foramen is so named because even though blood vessels and nerves pass through it, it is nearly completely closed by the fibrous obturator membrane. Coming to the next bone, that is pubis. Pubis, meaning pubic bone, is the anterior and inferior part of the bone. A superior ramus, an inferior ramus, and a body between the rami make up the pubis. Superior ramus, inferior ramus, and body in between between the rami make up the pubis. The anterior superior border of the body is the pubic crest, and at its lateral end is a projection called as pubic tubercle. This tubercle is the beginning of a raised line, the pectineal line, which extends superiorly and laterally along the superior ramus to merge with arcuate line of the ilium. The pectinate line merges with the arcuate line of the ilium. The pectinate line of pubis, P for P, pectineal line of pubis merges with the arcuate line of the ilium. These lines are important landmarks for distinguishing the superior, that is false, and the inferior, that is true portions of the bony pelvis. These lines are the landmarks for distinguishing the superior and inferior portions of the bony pelvis. The pubic symphysis is the joint where two pubes of the hip bone. The pubic symphysis is the joint between the two pubes of the hip bone. It consists of disc of fibrocartilage. Inferior to the joint, the inferior rami of two pubic bones converge to form pubic arch. The inferior rami converge. Below, inferior to this joint, that is inferior to pubic symphysis, the inferior rami of two pubic bones converge to form pubic arch. In the later stages of the pregnancy, the hormone relaxin produced by ovaries and placenta increases the flexibility of pubic symphysis to ease delivery of the baby. And weakening of the joint together with an already altered center of gravity due to enlarged uterus also changes the mother's gait during pregnancy. And acetabulum is a deep fossa. Acetabulum is a deep fossa formed by ilium, ischium and pubis. It is a deep fossa formed by ilium, ischium and pubis, and it functions as a socket that accepts the rounded head of the femur. Together, the acetabulum and femoral head form the hip joint. Remember this point. Acetabulum and the femoral head form the hip joint, not the hip bones. Acetabulum, which is a deep fossa formed by ilium, ischium and pubis, and the femoral head form the hip joint. On the inferior side of the acetabulum is a deep indentation, the acetabular notch, that forms a foramen through which blood vessels and nerve pass and serves as a point of attachment for ligaments of femur. The ligaments of femur attach at foramen acetabular notch. The ligaments of the femur attach at acetabular notch. This is the iliac crest, ilium and hip joint. Hip joint is formed by the head of the femur and acetabulum. Acetabulum is a deep fossa that is formed by the union of ilium, ischium and pubis. And this is ischium. And this is the obturator foramen. This is the largest foramen of the skeleton. Now let us discuss about hip joint. Coming to the definition, the hip or coxal joint is a ball and socket joint formed by the head of the femur and the acetabulum of the hip bone. Hip joint is a ball and socket joint that is a type of synovial joint. Hip joint is a type of synovial joint. Even in synovial joint, to be more specific, it is a ball and socket joint that is formed by the head of the femur and acetabulum of the hip bone. Here you can see the hip joint. This is the hip bone and this is the femur. And these are the tendons. This is the tendon of reticulus femoralis muscle. And these two are the pubofemoral ligaments. And this is the obturator canal. And this one is the obturator membrane. And the entire thing is the obturator foramen. Now coming to the anatomical components of the hip bone. The first characteristic feature is the articular capsule. Articular capsule, it is a characteristic feature of synovial joints. Very dense and strong capsule that extends from the rim of the acetabulum to the neck of the femur is the articular capsule. With its accessory ligaments, this is one of the strongest structures of the body. The articular capsule consists of circular and longitudinal fibers. Articular capsule consists of circular and longitudinal fibers. The circular fibers, called as zona orbicularis. The circular fibers called as zona orbicularis form the collar around the neck of the femur. This zona orbicularis, they form a collar around the neck of the femur. Accessory ligaments known as the iliofemoral ligament, pubofemoral ligament and ischiofemoral ligament, they reinforce the longitudinal fibers of the articular capsule. The next anatomical component is iliofemoral ligament. Thickened portion of the articular capsule that extends from the anterior inferior iliac spine of the hip bone to the intertrochanteric line of the femur. This ligament is said to be the body's strongest. The strongest ligament of the body is iliofemoral ligament, and it prevents hyperextension of femur at the hip joint during standing. Iliofemoral ligament, it prevents the hyperextension of the femur at the hip joint during standing. The next is pubofemoral ligament. Thickened portion of the articular capsules that extends from the pubic part of the rim of the acetabulum to the neck of the femur. This ligament prevents over-abduction of femur. Pubofemoral ligament prevents over-abduction of the femur at the hip joint and strengthens the articular capsule. The next is ischiofemoral ligament. Thickened portion of the articular capsule that extends from the ischial wall bordering the acetabulum to the neck of the femur. Thickened portion of the articular capsules that extends from the ischial wall to the neck of the femur. Ischiofemoral. This ligament slackens during adduction, tenses during abduction, and strengthens the articular capsule. The next is ligament of the head of the femur. Flat triangular band, primarily a synovial fold that extends from the fossa of the acetabulum to the fibio-captis of the head of the femur. This ligament usually contains a small artery that supplies the head of the femur. The next is acetabular labrum. Fibrocartilage rim attached to the margin of the acetabulum that enhances the depth of the acetabulum. Acetabular labrum is the fibrocartilage rim that attaches to the margin of the acetabulum that enhances the depth of the acetabulum. As a result, dislocation of the femur is very rare. The next is transverse ligament of acetabulum. The strongest ligament that crosses over acetabular notch. It supports parts of the acetabular labrum and connected with the ligament of the head of the femur and the articular capsule. Here you can see this is the articular capsule. This is one of the strongest articular capsules. The next is acetabulum. This one is the acetabular labrum. And this is the hip bone. And the yellow color one is the synovial cavity. Here is the fovea captis of the femur. This is the femur bone completely. This is femur. This is the lesser trochanter of femur. And this is the greater trochanter of femur. And this one is the zona orbicularis. And this one is the transverse ligament of acetabulum. Here also this is the zona orbicularis and this is the hip bone. And this one is the ligament of head of the femur. Coming to the movements, the hip joint allows flexion, extension, abduction, adduction, lateral rotation, medial rotation and circumduction. Total 7 types of movements of the thigh. The extreme stability of the hip joint is related to the very strong articular capsule and its accessory ligaments and the manner in which the femur fits into acetabulum and the muscles surrounding the joint. Although shoulder and hip joints are both ball and socket joints, Hip joints do not have a wide range of motion. This is an important point. Although shoulder and hip joints are both ball and socket joints, hip joint does not have a wide range of motion like the shoulder joint. Flexion is limited by anterior surface of the thigh coming in contact with the anterior abdominal wall when the knee is flexed, and by tension of hamstring muscles when the knee is extended. And the extension is limited by tension of iliofemoral, pubofemoral and ischiofemoral ligaments. Abduction is limited by tension of pubofemoral ligament, and adduction is limited by the contact with opposite limb and tension in the ligament of head of the femur. Medial rotation is limited by tension in the ischiofemoral ligament, and lateral rotation is limited by tension in the iliofemoral and pubofemoral ligaments. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.